This chapter covers integumentary or skin diseases and disorders. Alopecia is baldness. Usually, um, it is caused by things like chemotherapy or radiation, things that are used to treat um, cancer or something like that. Um, it can be either temporary or permanent, depending upon what caused it. Um, it can also be heredity and aging based, or specific illnesses and dermatitis. Generally, they can lose it in oval patches with signs of inflammation, um, and which is a specific alopecia type. Hair loss due to heredity or aging is probably not going to be benefit from alopecia treatment. Um, Otherwise, you treat the cause of the baldness if that's the case, and then there's medications such as minoxidil that can be used, or finasteride, or they could simply wear a toupee or a wig or a hair piece. They could also potentially have hair transplant um, with the finasteride, uh, since women also can have some baldness issues. They should not be taken during childbearing capability because it can have a tetragenic effect on a male infant. Corns are typically very common. It's a localized area of um, hyperplastic stratum corneum of the epidermis. Uh, Generally, relieving pressure and friction points are one of the beneficial things in treatment, and most resolve with treating or removing whatever's causing the pressure or the irritation. We see these on the feet pretty often, and a lot of times it's because the shoe doesn't fit quite right and rubs until it creates a corn or a callus. Um, the callus is typically larger and more common on the ball of the foot or the palm of the hand, whereas corns uh, are more painful than calluses and usually on the toes. Verruca is the actual medical term for warts. Uh, Three most common are common warts, plantar warts, and flat warts. Most common of those three is a common wart. It's a little small, hard, round, pink, cauliflower-like lump or lesion on the surface. Usually, you see them most frequently on the hands or the soles of the feet, sometimes on the fingers. Um, they are overgrowths or hyperplasia growth um, of the epidermis. Um, Most of them are painless. Um, Obviously, being on the sole of the foot would make it difficult. Feel somewhat like a stone in the shoe, so could be a little painful, but most cases aren't very symptomatic. Folliculitis is an inflammation reaction in the hair follicles that causes them to flare up and become pustular lesions. Um, Typically, you're going to have the patient seen somewhat frequently or somewhat quickly. Uh, the problem being is the skin goes through an opening in the hair follicle, causes infection, and the diagnosis is based upon the presence of hairs within the pustular lesions. You see them mostly on the thighs and the buttocks. They're usually asymptomatic. They can be chronic, but usually the microorganism that causes it is Staphylococcus aureus. Nails with any unusual thickness or difference in shape or color are usually considered to be deformed or discolored nails. Um, and it, um, Basically, some of the causes can be injury to the nail bed or pressure because of misfitting shoes, that kind of thing. Anemia can also cause nail beds to look pale. Um, People who have hepatitis or some kind of liver disorders, it may change uh, the nail bed colors too, and the appearance of the nails. Or patients who have cardiac problems and so forth may change the nails. So the nails basically is a part of the diagnosis of a patient in a lot of conditions. So it is an important part of a patient review of systems. Iron deficiency and anemia can cause the nails to kind of spoon. Congenital heart disorders and lung disorders can cause um, clubbing, and nail discoloration, as we said, can be caused by a lot of things. Vitamin and mineral discolorations may cause white patches on the nails. Nails that are injured and damaged usually grow back in about 9 months. Um, there's a lot of things that you can see in disformities and discolorations because of certain illnesses. Um, Sometimes nail may have to be, if it's an ingrown toenail, for instance, that can't be fixed. Otherwise, they may have to actually remove the nail and the nail to the nail's fold, and then watch the nails and trim them to prevent in-toe nails. Malformation in the nails. Generally because of they've been injured to the nail or the nail bed, uh, uh, can also be a factor to look at with the nails. Um, so there's a lot of things that are recommended in foot care, such as wearing loose-fitting shoes, maybe a shoe that has a boxier toe, for instance. Um, Keeping the feet clean and dry to prevent infection, cutting the nails straight across, that kind of thing. But a lot of times the injury to nails is one of the things that can cause some more problem. Paronychia is infection of the skin around the nail. Um, it may also You may also feel it into the hand, um, caused by bacteria or a fungus. Culture and then treat usually with antibiotics or with an antifungal cream. Necrotizing fasciitis can lead to significant complications, including really the loss of a limb or damage or scarring. It is a bacterial infection. It spreads by body system. Um, Early symptoms are red, swollen skin areas. Pain radiates from the red area. Lab work is going to indicate an infection and would treat it then with IV antibiotics. And then if it can't be resolved quickly, probably surgery to remove the area of tissue that's affected and to prevent it from spread. These are usually very rapidly changing, so they usually have to catch these very quickly.